Emergencies that can happen at home to anyone are many, like diabetic coma, high or low blood pressure, heart attacks, insect stings, or even burns, God forbid, and many other things. In those moments, we usually don't know how to react. That's why we made a podcast episode on their channel about first aid and how to handle different emergencies. And to make things easier for you, you'll find the timing for each situation on the screen and in the video description so you can go straight to the part you need. The episode contains important information, so don't miss it, and we hope you'll also share it with all your loved ones, friends, and everyone you care about. May God protect everyone.
All right, let's talk about insect bites.
Okay, so if I'm at home and a bee stings me, if it stings me on my face, it shows up immediately. My eye swells up, or my lip swells, or the spot where I got stung swells. You put me in another place, that spot swells and hurts. But if I don't have a severe allergy, there will just be swelling and pain. So what should I do, doctor? For insect bites, to reduce the swelling, if I don't have a severe allergic reaction, put snow on the place where the rice is. I can wash it with water, or apply an ice pack. Then I can use a soothing cream and take something to reduce the swelling. We call these anti-swelling and anti-inflammatory medications. And if I have severe pain, I take a painkiller, whether it's a syrup for children or tablets for adults. Now, sometimes insect bites cause a severe allergic reaction, which we call, in simple terms, anaphylactic shock or sudden allergy shock. What happens in this case? The eyelids and eyes can swell. The lips might swell a lot too. Breathing becomes difficult, and my voice changes. My voice starts to change significantly. Swelling begins to occur inside at the larynx, the airway, and the swallowing passage. I can't swallow, can't speak, can't do anything. And my nose is blocked. My lips are swollen, my eyes are swollen. This is called an allergic shock. At the earliest opportunity, you must be in the hospital. So why is that? Because people take an injection for allergies. It's called an adrenaline injection, and it's not actually available at home or in most pharmacies. It's only available in hospitals, but there are other injections, like a cortisone injection, which might be available in pharmacies or at home. And if the hospital near me is far away, I can start with these injections. But of course, it's better to take them at the hospital or at any health center. According to proper medical practice, injections shouldn't be given inside a pharmacy, but to save someone's life. We might do that until they reach the nearest hospital. All right, that's regarding insect stings or bites.
Most stings and bites, like from bees and ants, an ant bit me on my hand and my whole hand was swollen, my entire hand, to the point that I couldn't even close my hand. Even the nerves in my hand were affected. When I went to the pharmacy, he actually told me that if I apply this topical allergy ointment to anyone at night, I wouldn't respond. Then you should get a cortisone injection. But is that normal, or is it considered an emergency? I mean, the idea that my body suddenly reacts like that to something.
This is really beyond the control of doctors and patients, because no one really knows to what extent their body will react to a given trigger. Because the triggers are different. Some people get stung by a bee and nothing happens to them. Some people get bitten by an ant and nothing happens. And some people have a mild reaction. Some have a moderate reaction. And for others, severe allergic shock is not that unlikely. Every patient is different, and their experience isn't always the same as the next person's.
Every time.
Exactly, Lap. A patient might get stung by a bee today and only have a mild reaction. But another time, if a bee stings them, they could have a very severe allergic shock. Don't come back to us. So we just need people to be aware that if they experience symptoms of severe allergic shock, they must go to the hospital immediately. May God protect everyone, of course.
If we talk about loss of consciousness, about fainting, when can I say that someone has actually lost consciousness? How long does loss of consciousness last? Because sometimes people pretend to have fainted, like they're faking it or putting on an act. When can I say that this is truly a loss of consciousness, and how long does it usually last? Give us more details.
All right, look. Loss of consciousness means someone is unresponsive, like they've gradually collapsed, as if they're sleeping, but they're still breathing, and their heart is beating. But I don't really know what their vital signs are like. So if someone suddenly collapses at home, they might have their eyes completely closed, or their eyes might look dazed. But when we call out to them, they don't respond. Yes, sometimes they might say things while they're in that state. They might be uttering some words. It could be that what they're saying is a bit jumbled or strange. We find ourselves wondering, why is he saying that? And it's also possible that they're not speaking at all. But in the end, what I see in front of me is a person who is breathing and whose heartbeat is present, or at least they are breathing. So this is not a loss of life. This is just a loss of consciousness. For people who aren't doctors or medical staff, we consider this person to be asleep. But because we don't know his vital signs, we're forced to seek help. We take him to the nearest hospital and call an ambulance. The ambulance will come and take him to the nearest hospital. So Sari, the idea of the time duration isn't what determines it for me. Is this fainting or is it not fainting? The fainting episode itself is exactly what I just described, but the duration might depend on the patient's condition. For example, if he has low blood sugar, he'll stay in this state and won't get better. And if his blood sugar keeps dropping further, he'll start developing complications while in this state. It's the same idea if his blood pressure is low. It's also the same if he has internal bleeding. If someone had a previous brain injury or has a serious brain problem, they might remain in this state. The duration isn't really what determines whether it's fainting or not. Now, as for people who are pretending, we can't really tell people at home how to spot that. In hospitals, we have vital signs that we measure. So we make sure the vital signs are normal and that the person doesn't have anything concerning in their medical history. So we might use one of the methods we use in hospitals, for example, like smelling ammonia for the patient or causing them some pain in certain situations.
Keep doing that until they respond.
And that's something people can actually do. I mean, that's something people can do.
Pinch.
Exactly. Pinch or squeeze the patient as to cause some pain. Sometimes we pinch them, yes.
Doctor, some people get really aggressive with the pinching. Should I tell the doctor that I should go do it? Don't be aggressive.
As I said earlier, some people are just pretending. Like someone wants attention, a woman trying to get her husband's attention or her father's, or a boy trying to get his father's attention. So yes, there are people who actually do this. So the initial step we take is to pinch or do anything that causes pain to see if the person reacts. But we should also keep in mind that we need to go to the hospital to check the vital signs and make sure the person is okay.
All right. Everyone, don't do that so you don't end up getting pinched from the start. We were talking about, God forbid, may evil stay away. There are many situations where burns can happen in the kitchen with the iron, with something else. May God protect us. May God keep everyone safe. So what should we do?
Let's start with what not to do. And then I'll tell you what to do. First, don't put oil. Don't put toothpaste. Don't use those myths. Don't put ice. Some people put ice.
Ice actually burns.
That just makes the problem worse. So don't use any of these things at all, everyone. Even if someone already put oil.
And cornstarch and those things. Okay.
All of that is forbidden because it contaminates the burn area, and I will make the recovery in good condition. The chances of proper healing decrease. All right, so none of these things should be used. So what should we do then? Okay, what if I got burned? May God enlighten you. Just water, nothing else. I put my hand under water, God forbid, if my hand is burning like this. I put my hand under running water at normal temperature, maybe for 10 minutes up to half an hour. After that, you go to the hospital, the clinic, or the burns clinic, so the doctor can look at the burn, determine its degree, and tell you what the treatment will be. Okay, if I'm going to the hospital, what should I wrap my hand with? If I have clean gauze, I wrap it. If I don't have clean gauze, but I have clean cotton. We do not prefer strong cotton, and I have no problem with it because it slips. But if I have no other option, that's fine, there's no problem. But of course, gauze is better. Okay, if I have neither of those, any clean towel, I'll cover the area with it and head to the nearest hospital. Okay, is it okay for me to put something topical on the skin like an antibiotic ointment before heading to the hospital? The answer is yes, there's nothing wrong with that. But it's better, if I'm planning to go out right now, not to put anything at all.
They'll put on whatever they see fit.
Exactly. Well, I got 100. Some people, when they get burned, develop blisters filled with fluid. Exactly. Should I pop the blister at the site of the burn? No, absolutely not. Never pop it. Heard that, right? Deal with it. So in general, the fluid is just part of the burn. And after that, head to the nearest medical service.
We tell people not to put anything on burns except running water at room temperature. Don't try to treat it yourself at all. Cover it with something clean, as much as possible, but not cotton. And go to a hospital or see your doctor so they can treat the burn properly. All right, doctor, if we talk about chronic diseases that are present in every household, sugar and blood pressure, of course, people who have diabetes or high blood pressure usually know how to manage it. But when is it necessary to transfer a diabetic or hypertensive patient to the hospital?
Great. Let's start with hypertension. Some situations force the patient to act. With blood pressure, there are two things. Either it's extremely high or low, and each has its own signs. Low blood pressure, a patient who already has hypertension and is taking medication for it, if, God forbid, they experience a new health issue, like a stomach flu, for example, which causes dehydration, and their blood pressure was usually controlled with medication, but after becoming dehydrated, their blood pressure drops, or if, God forbid, they develop a problem with the heart's electrical activity, their blood pressure becomes low. So this patient starts to feel changes in their energy levels and alertness. They might feel unable to exert the same effort when moving around, and when they stand up, they may feel like everything is going dark and that they're about to faint. Their heart rate might also increase. The cat really likes to appear in videos.
Oh, these are my mom's cats, actually. They belong to my mom, too. Come on, let's listen to this blood pressure topic.
All right, let her benefit with us. So, for the patient who has these signs of low blood pressure, as we mentioned, their heart rate might start to speed up and the patient feels dizzy. The word dizziness is actually the most common word we hear from patients whose blood pressure drops. Alright, most of these patients have devices, so we always tell them that if you feel any symptoms, measure your blood pressure. If they measure it and the blood pressure is extremely low, they should drink fluids. If the fluids don't help, they should go to the nearest hospital. Right, fluids help raise the blood pressure a bit. Okay, as for blood pressure, sometimes, let me tell you that most of the time, it actually doesn't have any symptoms. I mean, when a patient's blood pressure goes up, they usually don't feel any symptoms. Alright, but rarely, when it does cause symptoms, what kind of symptoms are those? The patient might have a headache here at the crown of the head. That's what we call it, right at the top of the head. Sometimes they make a buzzing or pressure sound. A feeling of pressure on
The temples.
Exactly. And sometimes there's a feeling of heaviness on the chest. At times, vision sharpness starts to be affected, or there may be blurriness or double vision. And this is actually a symptom of complications. Also, if the high blood pressure has caused complications, some people experience a very severe headache, one they're not used to at all. So, if we notice any of these signs, we should also measure blood pressure. If you're a hypertension patient and you have a blood pressure monitor at home, you should check to see how your blood pressure is doing. Your blood pressure was high and you were taking medication that contains minerals, so what should you do, doctor? I will take a pill of the same type that I am used to and swallow it with water. And this point is important. Let's underline it. Why is it that so many people, when they find their blood pressure is high, put the blood pressure tablet under their tongue while they're at home? What are they thinking? This is high pressure. I want to bring it down quickly. Let me tell you, it's actually lowering blood pressure quickly that causes problems.
Absolutely.
Very, very much so. If blood pressure is high, we want to lower it gradually. So if you find your blood pressure is high, you can take an extra dose of your blood pressure medication, swallow it with water, and then head to the nearest hospital so we can run some tests. We need to make sure there haven't been any complications affecting the brain, on the eye, on the heart, on the kidneys, alright? So why do we go to the patient? If the patient at home has a device to measure blood pressure, but what if the patient doesn't have a device, my dear patient? If you experience symptoms like dizziness or any of the symptoms we've described, and you don't have any devices, then that means you should go to the nearest hospital, because this worries me about you, whether your blood pressure is low or high. We still don't know yet. We'll find out and then take the appropriate action.
All right?
Now, for diabetic patients, it's the same two concerns. Is your blood sugar low or high? Those who take diabetes medications, whether tablets or injections. People who take diabetes medications should monitor their blood sugar regularly, especially if they're using injections. And we train them, especially those who take insulin injections, because we're concerned about low blood sugar, so we tell them to check frequently. So they usually check their blood sugar about 4 to 6 times a day. Okay, what if I don't have a blood sugar monitor at home and I have a diabetic patient who suddenly feels dizzy, shaky, and is sweating heavily? There's a change in their level of awareness, a change in their ability to concentrate. They might even start to become a bit confused or say things that don't make sense, which worries us about both low and high blood sugar.
So in both of these cases, it could potentially lead to a coma, confusion, or even a complete loss of consciousness.
Both situations can cause that, but there are two symptoms that are more common with low blood sugar: the shaking that the patient might experience and the heavy sweating. These usually happen with low blood sugar, but since we don't know whether the patient's sugar is high or low, we tell the patient to have something sweet if you don't have a monitor and head to the emergency room. What's this? But so-and-so had high blood sugar.
Sugar high.
Yeah, you'll kill him or cause a disaster. No, it won't cause a disaster or kill him, God forbid. But if he stayed drunk, he would be low.
You'll pay for it.
He could lose consciousness, and if we're heading to the hospital and his sugar drops even more while he's driving, he could have an accident.
Yeah, he could pass out.
He could pass out because that's what happens. So since we don't know whether it's high or low, we tell the patient to have something sweet and head to the hospital, and it's better if you're not the one driving your car, just to be on the safe side. So, for those who have a device to check their blood sugar and it shows it's low, they should have something sweet. We train them to take 15 grams. Anything with sugar as long as he's able to swallow, and then check again after 15 minutes. If it's still low, take another 15 grams of sugar and check again after another 15 minutes, and so on. Now, if his blood sugar is high, if he checks at home and finds it's high, we tell him to come to the hospital. We usually discover this when I run kidney function tests for him, and we do blood gas tests so we can determine whether in the hospital he needs a solution with insulin or not. That's regarding diabetic patients.
All of this is new information to me. The idea about diabetes, even if, your blood sugar is high and you feel something, but you're not sure if your blood sugar is high or low, so you take something sweet just in case it's low, so it goes up quickly and helps you out. And if your blood sugar is actually high, it won't really harm you or cause a big problem. So that's completely new information for me. If we talk about chest pain, like my chest hurts and I feel like it's angina, or those things people always talk about.
We call it a movie on my chest. It means the patient feels like something weighing several tons is sitting on their chest. Exactly. I have all the signs of angina pectoris. People feel severe pain in the chest. And it's not like what you see in movies where the person clutches the left side of their chest. It's not always like that. On the contrary, sometimes it comes in the pit of the stomach. The place where the severe pain is can be at the pit of the stomach. I like most of the patients. The second point is that the pain isn't localized to a single spot that you can point to with one finger. With angina, it's pain in the chest. It can be in the middle of the chest, that's the most common, or it can be on the left side, which is less common. The pain can radiate to the left shoulder, the left arm, or even to the lower jaw or the neck. It is often accompanied by discomfort in breathing, rapid breathing, or what we call shortness of breath. There may also be very, very, very heavy sweating. Now, for people who experience these kinds of symptoms, if they have high blood pressure and are already seeing a doctor, their doctor will have explained to them how to handle the situation. So if he has a blood pressure monitor, he checks his blood pressure. If it's fine or just slightly elevated, he takes an aspirin, chews it, and heads straight to the nearest hospital. If he doesn't know about the children's aspirin, he stays at home, chews the aspirin, and then goes to the nearest hospital. But what if he's not a hypertension patient and has never seen a doctor in his life, and no one has ever explained to him what to do or how to act? If you experience the symptoms I just described, go straight to the nearest hospital. Never say, no, I'll just take a painkiller and see if it goes away. This kind of chest pain is a 10 out of 10 or even more with severe discomfort, as if someone is sitting on your chest making it hard to breathe. And the pain radiates to these areas along with sweating. Please, go to the nearest hospital.
So do these symptoms always appear like this, or can they vary? You mentioned it could be in the upper stomach area. Does pain in the upper stomach also come with pain in the left shoulder and left arm? And all those symptoms, or does it come on its own? Just so people can tell the difference.
The symptoms of stable angina can include all the symptoms I just described together, and they are usually triggered by physical exertion and relieved by rest.
Sitting down?
When the patient does physical activity, they start to feel these symptoms. When they sit down, the symptoms begin to disappear. He comes to learn a little bit about what this verse is about, angina. Okay? In this area, it could also be gastritis. When I feel severe pain in the pit of my stomach, it could very well be gastritis. But how would I know while I'm just sitting at home? I would never know, because it's possible for this area to hurt without sweating and without the pain radiating to the left arm or the left side. It could still be the onset of angina, whether stable or unstable. You don't have to have all these symptoms together. It doesn't always have to be related to physical exertion. It could just be that I have pain here, and the pain might not even come with the exact characteristics I described. So how would I know if it's your stomach or your pancreas or your heart? We'll never know unless you go to the hospital.
So without interrupting you, the only striking factor is severe pain, no matter what, in this area and the points you mentioned, pain that is unbearable. If I feel any kind of pain, even if it's bearable, in any of these spots, I should go to the hospital, right?
Exactly.
All right. Okay. I think we've pretty much covered all the points that could happen in any of our homes. May God protect everyone. So if we have, say, a small pharmacy at home with first aid supplies, what do you recommend we should all have in our homes?
Great. Of course, every home should have gauze, cotton, and antiseptics for wounds, like betadine, for example. It's best to have a DUS ready-to-use allergy injections. These injections are a bit expensive and not available in most pharmacies, but they can be ordered. Okay, it's expensive, but it's great because it lets me know that if I or someone at home experiences an allergic shock, I can give them the injection in the thigh muscle. It's easy to use, ready for immediate use. You just open it and inject it, just like you see in the movies.
So this is for cases of allergic shock when the whole body swells up, right? No matter what the cause is. I found a swollen person in front of me. I want this injection for him. Is that correct?
He took a deep breath and started to lose his voice. His eyes started to wander. Or their lips are swelling. After something happened, like being exposed to any kind of chemical, he ate something that caused him an allergy.
They really do lose it.
Exactly. Yes, that is absolutely right.
All right.
So why do we have gauze in the room? It's so that if someone gets injured, we know how to cover the wounds.
Okay.
Why the allergy? So we know how to handle it. Some people, for example, the nearest hospital to them might be an hour away from home.
All right.
Not everyone around us places that provide medical services.
All right.
All right. In our homes, we should have simple painkillers available. The ones we call over-the-counter, which are sometimes sold in supermarkets like paracetamol. And it's preferable not to have any other painkillers. If I have very strong painkillers at home and I take them for someone's stomach pain, how could that hide the real issue? So always remember, if people have a painkiller at home, it should be paracetamol, because it's probably the safest. It's the safest active ingredient like Panadol, Propanol, Adol, and so on.
All right.
A simple painkiller like that, a simple antispasmodic. If someone has mild or moderate abdominal pain, they can take an antispasmodic. All right. Burn creams. there are burn creams available at pharmacies. If the nearest place that provides medical services is far from me, if I have someone who doesn't have a car and lives in a remote area and the burn is minor and they're not going to any place that provides medical care, and if the burn is minor, they can clean it with water and salt and apply the burn cream.
Like Meebo, for example.
Yes, like Meebo, of course. But there are also alternatives available in pharmacies because sometimes certain types become unavailable for a while, like when Meebo was out of stock for a period, but now it's back in pharmacies. But there are other alternatives as well. Now, there are some things that are a bit difficult for people at home to use, or we need to teach them how to use them. But for people who have taken first aid courses and are aware of this, we tell them to keep a compression bandage at home so that if, God forbid, someone suffers a fracture, we teach them how to immobilize the area of the fracture until they can get to the nearest facility. But this is a bit difficult to teach to people who haven't taken a first aid course or haven't seen how this technique is done.
How it's done, right?
In general, gauze, cotton as an antiseptic for wounds. Burn cream, an allergy injection, if I can provide it, the one that's ready to inject. And a compression bandage. These are probably the most common things you'll find in the fridge or in a drawer at home. A simple painkiller, an antispasmodic, a simple one, and if you want, you can also have a simple antihistamine as well. But we can't advise people to self-medicate at home. Always consult doctors before using any medication, especially if it's something specific. Not just anything like that. Simple general analgesic or cramp relief needs. That's basically it. May God protect everyone.
Amen, Lord. In the end, we thank Dr. Bassiouny very much for the valuable information he gave us today, which made us more aware of how to handle emergencies. Thank you so much, Dr. Bassiouny, for being with us.
Thank you.
Thank you very much. We look forward to having you on many more episodes of the podcast. Thank you.
God willing. Thank you very much.
And finally, if you enjoyed the episode, please don't forget to hit the like button and share it with all your friends so they can benefit from the episode too. And of course, if you haven't subscribed yet, please make sure to subscribe. And don't forget to click the bell so you get notifications about all the new content we offer in our episodes. We're looking forward to seeing you in the next episode with more information from our medical team. See you soon.